Okay, folks, thank you all very much for arriving promptly. Gratefully appreciated. Good afternoon and welcome to the Health and Adult Social Care Overview and Scrutiny Committee. Before we start these proceedings, may I bring your attention to some housekeeping matters. There is no expected fire alarm this afternoon. Therefore, if the fire alarm sounds, please follow the fire and emergency procedures that are applicable to the Council House. This meeting will be broadcast live to the internet and will be capable of subsequent repeated viewings. By entering the Warspite room today, these committee members are consenting to being filmed throughout the meeting and to the use of those recordings for webcasting. Can I ask, please, that you speak clearly and directly into your microphone when addressing the meeting so the online participants and the public can hear, and that it's switched off when you are not using it. Your mobile devices should be turned to silent. Have we got any apologies for absence, please?
Thank you, Chair. Apologies from Councillor Deacon, apologies from Councillor Pengelly, apologies from Councillor Noble, Councillor Lang will be substituting today, and apologies from Councillor MacDonald, Councillor Plymouth who is subbing today. Thank you.
Because this is just a one-off, I'm not going to say that we need to go and elect a vice chair, so I think if we just continue. Having said that, if I suddenly need to leave the room, perhaps Natalie, if you would step in if needs be. Is everybody happy with that? Yeah. Thank you. Right, declarations of interest in regards to today's agenda, please. Councillor Finn. Use your mic.
Yeah, Chair of the Mayflower Group, patient participation.
Okay, thank you. Any urgent business? I have none, because this is the urgent business technically, isn't it, really? So we move on to item 4, West End Hub Programme Delivery. And you've all got some information. I'm sorry it came late, but we didn't receive it till late. So hence that quick reading sessions you had to do. Okay, who is starting? Oh, Joe, would you like to introduce yourself? Because there are some people that aren't normally on this committee, so it would be quite useful if you and Nigel introduce yourselves. Thank you.
Thank you very much, Chair. Don't get too close. So just for those of you that I don't know, so I'm Jo Turl, Director of Commissioning for NHS Devon, and I've been the Senior Responsible Officer for the Cavell project since its inception. I'm going to ask Nigel just to introduce himself.
Thanks, Jo, and thanks, Chair. My name is Nigel Atchison. I'm the Chief Medical Officer for NHS Devon. Lovely to be here.
Thank you, Nigel. And Matt, does everybody know you, Matt?
Yeah, thanks, Jo. I'm Matt Wardham, the Council's Head of Strategic Development Projects, and I've been involved with the Cavell Centre project for the last couple of years on the land and property and regeneration side.
Thank you very much, Matt. I was just going to do a little bit of an overview, if that's okay, Chair, and then I'll open it up for questions and comments. So first of all, thank you very much for inviting us. I think I was here a few months ago where we gave a little bit of an update on where we were with the West End Hub project. So I'm just going to give a little bit of an update as to where we are since then. Most of this will be covered in the board paper that you've got. And we are indeed, that paper is going to our public board on Wednesday the 15th of March, so next Wednesday, where it will be discussed and a decision will be made. But there are a few things I thought I just wanted to highlight just before we go into questions and comments. So since we last met, we had a really good conversation here last time and certainly received a lot of support from the committee in terms of the Cavell project. And one of the recommendations was to write back to the Health Secretary at the time and to arrange to undertake a meeting to talk about the future of the Cavell project and identify whether there were any possible solutions at a national level. So thank you for you doing that as a committee. We have since had that meeting. So Tracy Lee is the Chief Exec and leader of the council, along with Jane as the Chief Exec of NHS Devon and our director for the project, met with Lord Markham. It was a good meeting. It was an opportunity to explore options. There were broadly speaking a couple of options that we wanted to explore to understand if we could continue this project with some national support. So the first of those options was to identify whether there was any national capital that would help support the Cavell Centre moving forward. And the second of those options was to ask Lord Markham to consider at national level whether there's any opportunity to join up with the community diagnostic project, which is happening locally in Plymouth. So we undertook that meeting. We've written to Lord Markham since. We haven't had a formal response back to that letter. So this is kind of an update on where we are since then. We have, as we were asked to do as well, we have explored all options locally to identify whether there's something we can do to support this project. So we always said that this project was contingent on national capital being available, but we have looked at, I think, all options to see if we can continue this project, and those options will be outlined in the paper, and I'll come back to those in a moment as well. Also, just the third thing I want to highlight, so since we last met as well, all of the pioneer sites, so we were one of 6 national pilot sites for Cavell. The pioneer sites have been written to by the national Cavell team to ask us to stand down. So they've been working with the 6 pioneer sites basically to work on a national business case, which will go to Treasury for hopefully some support, some national capital funding. But they've got so far in that business case now that they feel that they're in the place where they've got that business case and they can present that to the Treasury, hopefully for some funding in the next spending review. However, that does mean that they've stood down all of the pioneer sites. So they were the 3 things I just wanted to update on in terms of what's happened since last time we met. So you should have a copy of the public board paper in front of you. There are just a few things that I thought it would be helpful just to highlight before I open up for questions. So as you can read it for yourself, but just to say that the ICB has been supportive of this project from the start. So I've been the senior responsible officer reporting into the NHS Devon board, who have been incredibly supportive of this project right from the start. And of course, if we had the national capital as originally identified, we wouldn't be probably having this conversation now. But I think that's an important point to note, because that was always the premise of the business case. And indeed, the board signed off the full business case, but it was on the assumption that we would get national capital. As you'll see, complete options analysis has been undertaken, but unfortunately it does identify that currently it's unaffordable to be able to support this project from local NHS Devon monies. We've really kindly had an offer from the City Council to borrow the money, but unfortunately the loan repayments are unaffordable given our deficit position. The last thing I wanted just to point out in the paper was that, and this is probably obvious to say, but the people most affected by this will be the patients of those practices. And I think that's a really important point to note, because this doesn't stop here. So whatever happens with the Cavell Centre, we need to make sure we've got really good, sustainable primary care practices within the city, and particularly within this part of the city. So we've committed to continue to work with these practices, whatever happens, to make sure that we have sustainable general practice for our patients. And indeed, I've got a meeting with a couple of other members of my team with the practices in a few weeks' time, just to identify what that looks like. So we'll be making a decision next week at board. So no decision has been made at the moment, but you can see the paper, you can see the recommendation that has been made. And it is a recommendation that I have to say has been made with a very heavy heart, given all of the time and energy that's gone into this, not to mention the disappointment that we know patients and particularly the practices will feel from this. But we have explored all of the options. None of them, unfortunately, at the moment are currently affordable, unless, of course, we do receive some national capital. But at the moment, we can't see that that's going to be, certainly not this side of the spending review, is going to be an option. The last thing I just wanted to say as well is we have certainly discussed here before about whether there are options for using our capital as a system. So as a system, we get an allocation of capital. I know we've discussed it here a little bit before, but we have explored what options there are around using our capital. We have looked at, so we know next year's committed in terms of our capital. We have looked at what future years look like. Unfortunately, there's such a backlog in terms of critical and essential maintenance. we can't identify this sort of funding from that budget. Second thing I wanted to say was just about our deficit position. So currently this year our deficit position is circa 50 million for the ICB. If we look at the Plymouth part of that, I think the hospital deficit position is about 17 million for this year. Unfortunately, currently as we sit here, that looks worse next year. So even if we just looked at the Plymouth element of that, because I know we've had conversations about fair shares before and needing to make sure that we realign, reallocate monies to make sure we're getting equity for patients. Even if we just look at the Plymouth deficit moving forward, it's looking significantly higher than the 17 million we've got this year. And sitting here, I don't think we could, without not a significant high level of risk, confirm that within 2 years' time, so when the Cavell site would be open, that we would be able to afford to pay back that loan from that point onwards. So I think we've tried to explore all of the options, but at the moment, unless we hear anything more in terms of national capital from the next spending review, I think this is where we are, but the commitment is to work with practices moving forward. So that's all I'll say at that point, Chair. Very happy to open it up for questions and comments.
Anybody want to come out? Ask Lee, you're first.
Yeah, it's just regarding page 9, option 6, about the viability of the three practices here. What is the current position statement on them? And point 2, regarding the 17 million, where does the deficit fall? Is it falling in patient care or capital projects, or where, please?
Yes, so I'll take you might have to repeat your first question to me, but the second part, so the 17 million, so that falls within the 49.5, so that's just the Plymouth, University Plymouth Hospitals part of the overall deficit. So that's a revenue budget, not a capital budget. But sorry, I didn't quite catch the first question on option 6. It was a question about option
What's
6.
the position statement regarding the 3 surgeries here? Because when we read in there, there are significant risks to all 3 services. The practices are adamant there are some significant risks to all 3 GP practices. The practices, and basically the status quo's are not a viable position. So is it actually putting these 3 surgeries in danger of disappearing, or are they going to be retained and to serve their communities?
Yeah, thank you very much. So this is a really important part of this paper. So that's the bit that we commit to moving forward, is working with those practices to make sure they remain open, remain delivering good quality care to their patients. So that's the bit of work we need to do next with them. And I think it's going to be difficult, it's going to be challenging, and staff and patients will be really disappointed, but we will find a way to resolve that.
Chris?
Thanks, Chair. That seems to be a bit finger in the wind wishful thinking. If you've got 3 practices all saying that they're in crisis, 2 of them not even having leases for their premises, all of them not having enough space to currently properly serve the people they're working, not able to recruit new partners because of the uncertainty and the conditions they're working in, and the experience of doctors' practices elsewhere in the city, could we be in a position where Stonehouse loses all 3 of its GPs within 2 years because they don't want to say we're going to hold here until sometime in the long distant future that we don't know what a plan is? Planning for 2 years of uncertainty is one thing. Planning for a long term is different. I know, as the ward councillor, as one of the ward councillors, Ian's here too, how long these practices have needed something, how long they've been holding on, and they're holding on by their teeth. And the paper gives us very stark, on pages 11 and 12, health outcomes for this community. We'll try and work with those practices seems to me too vague to be acceptable. And I'm not convinced, I don't normally sit on this committee, but I'm not convinced that that is a suitable solution, and one that I think just lets down the poorest community, not only in Plymouth, but in Devon, and actually quite large chunks of the southwest, by saying, oh, well, we'll just hope, we'll keep our fingers crossed, because that's what it sounds like to me. And a lot of those 16,000 patients are people who live in my ward and suffer from lots of other inadequate services as well. And you know, I think it just doesn't feel right to me to say, well, that's our solution, because it's a solution that isn't a solution. It's a short paragraph on a piece of paper.
Thank you. Can we just record that as a concern there and see whether we work it into a recommendation in a minute, Elliot, please? That would be useful. I've got Jemima and then Patrick.
Chris has said largely what I said. You said, Joe, you know, we want really good primary care practice in Plymouth. We have a solution. We've got it. This would give us that. This feels really defeatist to say, no, that's it. We can't do anything about it. And I agree with Chris. I don't think it's acceptable. This is, instead of improving things, this just continues the trajectory of things getting worse. The impossibility of seeing a GP and access to all the things that flow from that. And I don't think we're a defeatist city. We're an innovative city. We come up with ways round barriers and we find ways through things. We have got so much of this puzzle in place that at this stage to throw our hands up and say, oh, we're not going to do it, for all the reasons I'm not underestimating the importance of the reasons you've given. I don't think that's acceptable. We've got to find a way to make this happen one way or the other. And my question is around the loan stuff that you mentioned. Can you give us a bit more detail about that, and why, if that loan facility is there, what can we do to help you access that? Because I'm with Chris. I can't sit here and say, yeah, okay, let's give up. We can't give up on this, because for all the reasons Chris outlines, we have thousands and thousands of people who are deprived of so many things in so many areas. This is a thing that could improve their lives, their health outcomes, everything, and the children involved also. So I would find it very difficult to say, okay, sorry everybody, we'll have to do something else with that site and move on. I can't do that, but I'm interested about the loan details, please.
Can I respond, Chair? Is that okay? I'll respond to both questions. And your challenge is absolutely right. It's the right challenge. So the whole reason why we decided or took up the challenge to be a pioneer site was because of our concern because of these practices and wanting to do something better for that population of Plymouth. And that's the reason why we've put so much time and resources into doing this. So your challenge, and I think the recommendation potentially, Chair, to come back at a point in time and say, actually, what are we doing to support those practices is the right one. And I will assure you, though, those conversations are already happening. So we haven't put a lot of detail in the paper, and that is because it's a public paper, and some of this is commercial and sensitive. So that's why we haven't gone into that level of detail. But I'm really happy to come back here another time to say what conversations are we already having with those practices to make sure we are going to firm up sustainable primary care in that part of Plymouth. I think as to the question around the loan, I think it's a really good one. So we've been offered a loan from the City Council, which is a really good offer. It absolutely is. The payback over the life of the loan that we would need to take out, which would be over a significant period of time, but that's not unusual to do that over that length of time. But the payback of that level over the next 40 years, unfortunately, we don't have the budget for at the moment. So we're in a deficit position at the moment, both as an overall Devon, but also as a Plymouth system. Within 2 years' time, so within the time when this loan would start, we couldn't hand on heart with confidence say we're going to be back in a recurrent, sustainable place with our budget. And just as you have, I know you've got the same issues in the City Council in terms of having had a really difficult year in terms of budget. We can't commit to spend money that we haven't got. In fact, the current system that we're currently in at the moment, so we're in something called Soft 4, which basically means we're a very challenged system in the country. It means that we just can't commit to that level of spend with budgets that we don't have. It's actually not within our gift. So it's really difficult. I know you all know how difficult it is with your own budget setting, but it doesn't feel like a comfortable place to be in, but unfortunately it's the reality of the budget.
I was going to ask Matt if he can give us some idea of the sums, etc. I think that would be quite useful to put that into that context, since you've asked that, Jemima.
Yeah, I think there's a table in the paper which sets out the proposed payments. The proposed cost at the moment of the project is around £45 million, and so we've essentially said that we would the council would provide a loan of 45 million, and based on the current rates that we, as a council, borrow through the Public Works Loan Board, we would be able to offer a rate to the ICB of 5.35%, and over 50 years, the loan repayments work out at 2.6 million. So that was essentially the position that we put to Jo and her team. Would they be able to fund 2.6 million a year over 50 years to cover the cost of providing the building on the site?
Thank you. And of course, there would also be monies being paid out for the surgeries from the ICB anyway, wouldn't there, as to the be funding from that? Okay, Jemima, you wanted to ask something further from that?
No, it's not really not. It's just to say that, so if this doesn't happen and these 3 surgeries which are struggling at the moment, we already know that the knock-on effect of not being able to see a GP is that you go to A&E, or you know, and you're clogging up another part of the system which is costing more money. And I just think, as a layperson, of course, I don't understand all the technical side of it at all, but I know my residents in my ward would just say, you've got a solution here, and if you don't do it, all you're going to do is shift the money that you say you can't spare out of your budget into another part of the system where these people are going to cost money while they try to access healthcare that they need. It just doesn't make any sense to me when we're so far along the journey to get this centre. And I'm a bit disappointed you haven't had a reply to your letter either, and I'd be interested to see what that contains, because it doesn't, to me, bode very well in terms of what we might secure in terms of national capital, but I might be wrong there. But it would have been good to have had a letter, a response that we could consider as part of, you know, forming any recommendations that we might have. Thank you.
My understanding also is that the leader of the council and the shadow leader of the council sent a letter. Within the last 10 days, something went off from them as well, to say how concerned they were. I think even furious might be another word for it, but yeah, they were not at all happy after the last meeting that we had. Patrick, you had the joys of being the cabinet member when all this started, didn't you?
I did indeed, Chair, and I think I'd like to start, if I may, by emphasising the good work that took place under the proposed recommendation, bullet point 1 of the stakeholders. And without getting too political, Chair, this is ultimately about politics and about choice, because NHS Devon and the local authorities can only work under the parameters and the finances available through government. And I think it's a message here for the public that the City Council and our partners have not actually walked into this without effectively being led into a bidding scheme with the national projects that the government set out to try and facilitate through this process. And we openly engaged as a collective to benefit and improve the lot of our local communities. So there's been comment in the local press that the council preempted decisions, but what the public need to understand is that often you need to prepare extensively projects to put to government that are projects that are ready to go, because the government often wants to spend money in a very short period of time and justify obviously allocations of money. What I would say through you, Chair, is that effectively the government has led us up the garden path and have pulled the rug from this local authority to provide vital investment in healthcare. And I want to really challenge us as a scrutiny panel and challenge elected members that I don't see any reference in here to interacting with members of Parliament in Devon. And Joe's absolutely right. This isn't just a Plymouth issue. Primary healthcare is a Devon-wide concern. Yet we have a Secretary of State for Department of Works and Pensions, Mel Stride, sitting in the Cabinet. We have Johnny Mercer attending Cabinet. We have the longest serving Member of Parliament in Devon, Gary Streeter. There isn't much reference of them doing much and getting off their backsides to help us in Devon and help us in Plymouth actually deliver for the people that we represent. So I would like to actually move a further recommendation, or a recommendation of this scrutiny panel, that there is actually, Plymouth should take the lead in perhaps convening a Devon-wide Member of Parliament meeting supported by key officers of the various stakeholders to actually not just talk about Plymouth's needs, but Devon's needs. Now, Joe has attended this scrutiny panel for a very long time, and has recited the financial difficulties that Devon's been in for a long time. And what are Devon members of Parliament doing about it? I don't know. So they need to be held to account, irrespective of party, of what they're doing to raise the concerns of Plymouth and Devon at a national level, what they're doing to influence government through those that attend Cabinet in terms of the comprehensive spending review. We've got the impending budget. We need some real answers. And if you know the choice of government is, I absolutely support the principle of enhancing the high street. But in Plymouth, we're spending £12 million on Mod Away, 10 million of that's coming from council resources. You know, the government is spending enormous amounts of money on cycling and walking schemes. Fine, you know, I'm not saying I'm against them, but actually, perhaps the balance between healthcare, you, Chair, and a number of us in this room, Councillor Tuffin included, have been going on about dental healthcare in the city for years. We've equally seen in Plymouth a total dereliction of the NHS to invest in primary healthcare, in doctor surgeries, yet you can go to other parts of the country and rural communities and they've got better healthcare than we've got in any district in Plymouth. That can't be right. So if we can't sort it at our level, then members of Parliament should be brought before us, if necessary, privately, but then in a public forum, to actually account for their actions. Mel Stride in this time, Chair, was Chief Secretary of the Treasury. We have connections that the current Chief Secretary of Treasury stood for Parliament in the Devonport constituency. He's not a million miles away in Salisbury. So, you know, it's about time perhaps we had a more grown-up political debate with our members of Parliament. You know, Johnny Mercer's always gone on about Derriford. Well, actually, we need to stop people getting to Derriford in the first place. So let us have a recommendation to make members of Parliament more accountable in this process, and I very much look forward to taking part in the coming months in that debate. Thank you.
Thanks very much, Patrick, for that. And certainly I find it very bizarre, to say the least, that the National Cavels project was set up and then they just pulled the plug on it. That to me seems absolutely bizarre that they've ever got around to doing that and putting expectations out there and money's being invested in it. And, you know, I think that's crazy. Lee.
I think it's just to follow on from what's been said from all the contributors, from Chris and Councillor Lang, etc. I think we're in a position now, it's clearly gone wrong. And I think we need to consider a recommendation before this committee is what has gone wrong. We need basically an autopsy from the start to the finish. Maybe there's lessons we can learn here with regard to the future. Is it to do with the messages, stakeholder messages? Did we promise too much to the public, so it's going to come back and bite us? Obviously, the net cost of the council budgets, the net cost to the taxpayer, etc. There's obviously the inevitable outcomes to patient care and the uncertainty that Councillor Pemberley mentioned. So there's a lot to examine, and I think we really do need as a committee to sit down, take this apart, find out what went wrong, and above all, with regards to, especially when budgets are tight and we've, as a council, expended so much money in something which isn't going to happen now, it could have been better spent elsewhere, that we really do as a committee need to sit down and take this apart, find out where it went wrong and make sure it doesn't happen again.
I've got Chris, then Patrick, and then Jemima.
Thanks. I think I want to pick up on a bit of a theme, but try and pull it. One of the things we've been talking about for a long time here is system working, not silo working. And we've been talking a lot about early interventions and preventions. At the moment, it feels that we're doing neither. In Stonehouse, DWP have established that high rates of unemployment are not just linked to skills, they're linked to ongoing health problems, especially mental health problems. So we are paying substantially more people in Stonehouse not to work because we can't get their health sorted out. That's a cost to us all through DWP, and it hinders an economy at the point where we're being told that we can't get enough care assistance. So we can't get people working in the NHS, but we can't care for the people in order for them to be able to be fit to work in the NHS. Now that just seems stupid and is costing the council and the government money at every single point. We talk about this community being a community that is going to be more likely to use emergency services. They're the lowest car owning community in the city and the county. The way they're going to get to Derriford isn't on a bus, because the buses don't run evenings and late weekends. They'll be calling an ambulance. What do we know at the moment? The ambulance service is under stress. And we know that actually accident and emergency are under stress. It's well documented that poor dentistry leads to bad teeth, which lowers confidence, especially in children, which harms their ongoing success and employability, as well as leading to pain. Where are we? This is the community with really massive dental needs, no NHS dentists around. Here we've got 10 chairs not about to be provided. And we're not tying it up with anything else. You know, my next briefing, and I am going to have to leave early from this, is on the other 5 schemes in the city centre, which are all about bringing the city centre up to standard so we can intensify housing. We've already got planning application for hundreds of new homes live at the moment in the system that will all be within 5 minutes walk of this proposed site. None of those people are going to be able to get into existing doctor's surgeries, either in Stonehouse or at West Hoe. And are we expecting West Hoe to pick up all the slack? Because that's not going to work, and we'll have another doctor's surgery falling over. We're not looking at this as a whole. We're looking at this as, oh, we can't spend that money there. We're not thinking about the financial implications on accident emergency, on dentist surgeries, on ambulances, or on other growth factors in the city that's actually about meeting the needs of our current and future populations, which in turn produces council tax, which supports the services that needs, you know, this just seems to be not knowing the value of something and purely approaching it on cost. And I think it's about time that the work we keep on talking about systems, which is being driven not just by the council, but by the NHS and other services as well, and the systems we talk about in terms of early intervention and prevention are put into practice. The last few paragraphs of this report talk about the really complex needs these doctor surgeries are currently dealing with, and they're not being picked up elsewhere. DWP aren't really working to support people into work because they can't, because they need the medical interventions. You know, schools are trying their best, but they're dealing with the impacts of that on people's lives. It's having impacts on drug and alcohol services. And the one bit that might actually help us unblock all of those things, actually, in those terms, £45 million is peanuts. We're talking about lives. And what are we going to do about the 5,000 extra homes that are being put into the city centre and Mill Bay within the next 10 to 15 years? Where are those people going to go? Where are we future-proofing? I don't think any imagination is really being used. I think it's just, we can't do it. An accountant says no, so we'll say no. So it's just not good enough. You know, I'm really angry that the people who are being let down are the people who need us most. And surely as a society, we should be looking after the people who need us most. And I think we should have a recommendation, Chair, I probably won't be here for that bit, around systems working, early intervention and prevention, and actually this project, looking at this project from those perspectives, not just from the perspective of a balance sheet.
Thank you very much indeed for that, Chris. Much appreciated, and certainly we'll be noting that. Nigel.
Thank you. You've absolutely articulated why the Integrated Care Partnership, the One Devon that brings all of the stakeholders together, and indeed One Devon, NHS Devon, which brings together again the health partners, but local authority in a way that we've never had a chance to do before, is so important. So we're set up and constituted to do 4 things. One of them is to improve the health and healthcare of our population. So the prevention piece is front and centre in a way that I don't think it's ever been before, bringing back together public health colleagues in a way we've not. Inequalities is one of the 4 things that we're badged to try and reduce. And the partnership working, I was going to pick up that in this part of the county has been amazing for many, many years, and in our new framing is one of the ways I hope that we can begin to think about addressing exactly the needs of the people in your ward. for whom it's not all about the health interventions, it's about the social determinants of health, exactly as you mentioned, which are not, they're not directly health, but of course they impact on health and they impact on opportunity for those people in the ward. So that is part of what we're trying to set ourselves up to do. We shared the disappointment, as Joe said right at the beginning, that we absolutely backed this proposal, this opportunity for us to bid for this national funding, and we are very disappointed that at this point in time we haven't got access to that funding for this particular project. But again, as Joe has said, not only for the general practices in your ward, but for the people whose needs we're trying to meet collectively, that work will not stop. It's just that at this point in time, this particular project is one that we do not have the capital funding to take forward. But you are absolutely, you describe exactly what we've been set up to try and achieve differently this time.
Could I suggest then that when you don't do this within a couple of years, you'll be failing? And you'll be failing because the people who are the real indicators of that deprivation and the worst health outcomes are going to be worse off, not better off, because there'll be more people trying to access existing services which are already creaking and crumbling and relying on the goodwill of a few GPs to make it happen. And that goodwill is not going to stretch forever. And, you know, where are you at filling all the other GP vacancies around the city, let alone getting GPs to take on practices like this, which takes so much more than a normal GP would do and take real dedication and care, which I'm not saying other GPs don't have, but you need to be a very special sort of GP to take on this sort of practice with this sort of outcome at the moment. And I think that the measures you've just said are your measures of success. Without this, you're going to fail. And you're not just going to fail yourselves, you're going to fail everyone who lives in this area and actually the rest of Devon as well, because ultimately the mess to be picked up is going to have to be paid for from somewhere. And that somewhere is going to have to be the rest of Devon, because that's where the budget now sits.
Can I just respond? So, we hear, and as I said, we shared the disappointment with this particular project. But that is not the end of our ambition to support the people in your ward and the other wards right across Devon in the ways that we've described. And neither is at the end of that opportunity. It is disappointing, and we've shared that disappointment, but that will not stop us. We're not going to walk away from here and say, oh, actually, that was our plan. There is no plan B. We will be continuing to do all of that work with our partners in the way that we described. So. And of course, one of the reasons we're here today, we are happy to come back and talk to you about what that looks like, and we'll be happy to do so again.
I think one of those things we need to be considering is the financial package in effect to the council, having a contract in place that's only valid till September about guaranteed prices for things, and how that impacts on anything going forward. And I think the other thing, Chris, that I've been advised on, there are patients in those three practices now that have moved to other practices because they weren't sure as to what was happening. So pressure is already beginning to build on other practices because patients are walking away because they feel so uncertain about the future of those three practices. Patrick, you're next.
Yeah, thank you, Chair. I wanted to come back on Councillor Finn's point, but I think the messaging I would hope that we would be really given from this meeting is that, yeah, we're very disappointed, but the game isn't over. The project is still, it's still there. It's still a proposal. We just need to convince those who can provide funding in the future that it's a resource and a work stream that government should be funding. So, I certainly would hope that we're not defeatist. And coming to Councillor Finn, Councillor Finn, there's absolutely nothing that we've done wrong. We have, across the council, as you'll be aware as an experienced councillor, a number of opportunities across local government to bid for specific resources. It's a way government have allocated a proportion of the national spend. So they'll allocate it in a variety of ways, but these specific proposals. And you've heard in this meeting, but previous meetings, that the Cavell project had the 6 pilots. So we were encouraged to bring forward a proposal. We haven't done anything wrong. We haven't led the public up the garden path. We've been led up the garden path by the government, pulling the national funding for this work stream. So please don't give the impression that we've done something wrong. And it's an impression that one or two people have written in the postbag of Plymouth Live, thinking that the councillors have preempted decisions inappropriately. We haven't. We have tried our best. Now, we are a landowner at Colin Campbell Court, and it's only right that empty shops that have plagued the area, the council can, as its own freeholder, decide to demolish a few shops. You know, the whole future of Colin Campbell Court has been under debate pretty much ever since I've been a councillor for 30 years, with variety of proposals. And I think it's only right that the council proactively tries to redevelop an area. It's just unfortunate the proposal that we are trying to support, the government aren't prepared to fund. So, you know, I'm not in to have to get partners in this proposal to be inwardly looking at what have we done wrong. I don't believe we've done anything wrong. I speak, having been the cabinet member responsible for health and adult social care and working with partners to get the planning approval through the planning system, we haven't done anything wrong. If you want to spend and expend energy, it's on those at government level that have decided to pull the plug on this funding stream. So I hope very much, you know, we take that into account and not start trying to blame ourselves for not seeing a project come to fruition. We have nothing at all to be disgraced about, and we should put all our energies into convincing those in government who can give the resources to make this a reality. And the more effort we put into that, the better, especially as we approach a general election and we'll all be out for votes.
I think Joe made that very apparent that it was a national project, 5 pioneer sites, and then the government then pulled the plug on it. Yes, I think that's been very clearly stated. It's not something that Plymouth went out trying to get. It was the government pulling that plug to start with. Matt, sorry.
Yeah, thank you, Chair. I think I'd just like to take us back, if I may, just briefly to actually 4 years ago, before there was any reference to Cavell Centre. And at the time, the council identified that there was a need to improve health facilities and working also to regenerate the Colin Campbell Court area. So when I started in post 4 years ago, my predecessor had commissioned a piece of work looking at how the council itself could deliver a new primary care facility of around 4,000 square metres on some land at Colin Campbell Court, and that was where we were headed. We didn't come forward with any formal proposals for that, but our consultant demonstrated that it could be commercially viable, and we'd had engagement with the GPs and with LiveWell and others. And it was because that was essentially an oven-ready project that we could have delivered, that there was interest from other health partners, and it was then that the Cavell Centre, the idea of Cavell Centres came about, and that's when the conversation around the Cavell Centre took over, and we realised firstly that there was even greater demand than we had first thought, and so we'd moved to a building of 6,000 square metres, and then of course the offer of the funding came from NHS England with the 2.5 million which they provided the ICB to help work up the proposals. I think one of the challenges I think that we have now is that as Joe has highlighted, if we sit and wait, then we are essentially waiting for a spending review in the autumn of next year, which may or may not happen. If it does happen and the funding is allocated, then we know that funding won't be available until at least April 2025, but there are no certainties around that. In the meantime, we still have a site. The council, as Councillor Nicholson has just highlighted, the council has over the last 6 months emptied those shops and carried out the demolition, because we had to do that in order to meet the timescales that were set for us by NHS England. So we will still want to look at how the project, how Colin Campbell Court is regenerated. We're talking to University Hospitals Trust at Derriford at the moment, because they've got proposals which you may be aware of for a community diagnostics centre, so one of the questions that we will have to consider after this meeting, if the Cavell Centre doesn't go ahead as planned, is could that take the place of the Cavell Centre, and if so, in 18 months' time, if funding is allocated to the Cavell Centre, where does that go? And also, what does a Cavell Centre in 2 years' time look like if we've got uncertainty at the moment around the GPs and who would actually be part of that project.
Jerry, you wanted to come back in?
I'll be really brief. I just didn't want to lose the point that Councillor Nicholson made about the system working, because that's a really key point for me here. This has been, and you know, we are deeply all disappointed about where this has got to, but the system working, partnership working that's gone into getting us to this place was absolutely phenomenal. Just before I came in here, Anna and I were having a very quick conversation about what this city has managed to achieve, particularly over a very difficult winter period, looking at supporting discharges, etc. And we would never have been able to do that working separately in our silos. This is really good system partnership working, and that we just need to make sure that we maintain that in whatever we do moving forward.
Thank you. Jemima?
The latest statistics that we've got said that more than 5,000 patients in Plymouth waited more than a month to see a GP in January. And I'm at the risk of repeating myself, we have a solution here to take a big chunk of that. I know what it's like to try to access a GP for someone who needs it. And I had to practically stage a sit-in in a GP surgery to get somebody to see the person that needed to be seen. And I just feel that this, you know, Nigel, you know, you talk very well about it, about what will happen in the future and how we'll achieve things differently and all the rest of it. But actually, the people who are going to benefit from having this centre can't wait for that. And I really feel if you really mean what you're saying, and you need to literally put your money where your mouth is. We have to find a way to make this work. And Joe, you talked about the budget pressures on the City Council and all the rest of it, but actually the City Council have handed you a solution. In amongst all of that, they're able to lend the money. And I take your point about you can't afford to pay it back, but I just feel like you can't afford not to do it because the knock-on is too big. And if we already have 5,000 people in Plymouth waiting more than a month to see a GP, what's the knock-on there about late diagnosis and all the rest of it? I mean, we know all this stuff. We are all dealing with a pretty broken system, and this was a little bit of fixing and not a sticking plaster, an actual permanent solution to some of the problems in primary healthcare and the knock-on to emergency care in the city. And I just feel that the challenge from us is to just say, you have to find a way to make it work, because the site will go into abeyance. And you talk about the diagnostic centre, you know, and Patrick's right, what he says around, we haven't done anything wrong. I don't want to waste a second on looking at what went wrong. That's a complete waste of effort and time. The effort and time has to be put into how we can make this work. You talk about the diagnostic centre. Well, I feel a little bit cynical about whether that's going to happen now. You know, it just all feels a bit, well, you tell us this is going to happen, you lead us this far, and then, oh dear, sorry, we're all disappointed. Disappointment doesn't get people to see a doctor when they need to see one. Disappointment doesn't stop people going to A&E when they should be going to a GP. Disappointment doesn't stop people calling 999 when they can't get themselves to hospital. And we are at a tipping point in this city, and I just feel very strongly that the challenge from this committee should be to you to go away and find a way to make it work. Thank you, Chair.
Matt, can I just ask you about the site? At the moment, it's more or less cleared. I mean, there's a big mound of, well, whatever you want to call it, debris there at the moment. But surely, as the City Council, if this project is not going to go ahead, we cannot afford to keep it empty like that. We're going to have to make sure that something goes on it, whether it's housing, an extra care centre, whatever. We are going to have to use it. So it is going to become inaccessible to anybody else within a few years, surely.
Yeah, the rubble that remains on site has been deliberately left there because that was the intention, was that would be reused as part of the construction of the new project. But you're absolutely right, Chair. We mentioned the Community Diagnostic Centre. At the moment, there is a proposal that might go on the other side of the road, on the former Two Trees site. But from a point of view of that acting as a catalyst for regeneration, that we would prefer to see it on the eastern side of Western Approach. So it could be provided on the site where the Cavell Centre was going to go. And we have just appointed a firm of architects to put together an options study to look at the whole of the Colin Campbell Court and West End area so that we can progress regeneration. And I mean, apart from the health benefits that everyone's spoken about today, we had forecast, and this was in the business case that the ICB put together. We had forecast that there would be significant regeneration benefits, around 2,000 visitors a day visiting the project, as well as the people working there. And I think Savills had estimated that there would be about a 46% increase in footfall in the local area. So that is going to be something that we need to address as well.
And if we were to decide to build building with housing up the top of it, etc., am I imagining it, or have I seem to remember hearing that if that happened, the NHS would not go into a building that was shared with housing. Is this correct or not?
It's challenging, Chair. I mean, it was certainly something that we explored with the Cavell Centre. It's a conversation that we've had with the UHP in relation to the CDC as well. So there are some practical challenges with that, and there are also some funding challenges associated with that.
Fine, thank you. Sorry, Joe, you want to say something?
Yeah, I just wanted to respond. And I know I'm in slight danger of repeating myself. I know a little bit, but I'm just conscious the gentleman who left the room, he made a really good point about have we factored in what are the potential benefits or disbenefits, I suppose, if we don't do this, around that sort of that early intervention piece. And that is an extensive amount of work's gone into that business case, and we really, more so than ever on any other project, really tried to identify all of the potential benefits, particularly around the early intervention, supporting people's well-being, etc. And we got to a place where, broadly speaking, and we weren't quite there, but broadly speaking, we were just over break even on the project, but that was assuming the capital would come from the national team. So all of those benefits have been worked in. And since obviously learning that, we don't expect to get the national capital, the team have worked so hard to try and identify a way to do this. We've literally looked at every which way we possibly can to make this affordable, but it does come back to it's not affordable when we haven't got the budget. And if we haven't got the budget, we can't spend it. But Nigel's point made a really good point earlier on. So Cavell came along a few years ago, and it was an opportunity. It was a brilliant opportunity to try and help improve things for patients in this part of the city, but it isn't the only thing we're doing. So it feels like a lost opportunity. It absolutely is, but it is not the only thing we're doing. And our job is to carry on and to do other things and to work with those practice, work with community services, work with the community to find a way through this. And that is what we will continue to do.
It also sounds like you need to be working with the DWP to get things sorted out there as well, because they seem to be one of those partners that just are ignoring anything that seems sensible at the moment to be helping this community. Right, I'm going to take Ian, Tuffing, then Natalie, and then come back to you, Lee. Bearing in mind that Natalie and Ian haven't asked a question yet. Okay.
Thank you, Chair. We did get this paper late, and this is the first time I've heard about proposals to use a two-tree site. And I've got to say, I'm totally opposed to that, because if you look behind that site, Flora Court, where hundreds of people live, is blighted by that car park. It's like being in prison. There's a big concrete wall. It's discoloured. It's horrible. And to put something in there would just prolong the life of that site. So I really have concerns about that, and certainly would be totally opposed to that site being used. The other question is, Joe, you did say it's not affordable. I suppose the question to follow on from that is, what is affordable? Because you've done your sums on this, but I guess there might be a compromise somewhere. So having looked at the need in this area, what would be affordable from your perception to incorporate the council's offer of a loan?
Thank you, Ian. That's a really good question, and that is the bit of work that we're currently doing at the moment. So we have looked at what would a complete new build standalone, and it's in the options here, but I appreciate you haven't had long enough to really digest what's in the paper. So a completely new standalone for the GP practices, including all the additional roles that they've got, etc. That, so if we were able to borrow the money for the council, in fact, I think you could broadly probably use the 20 million that's in here. It would be less than that. It's probably about 15 million. We don't have the budget for that, but we need to do something to work with those practices. So that's a bit of work we need to do now, is what can we do either on existing premises, thinking about other premises, what can we do that could support them? And that's the bit of work that we have to do at the moment. And we're going to, as I said, I'm meeting with them not next week, the week after, to continue those conversations. But I'm very happy, as well as I said before, Chair, to come back here and update on that at the right time.
Thank you for that, Chair. I just want to say that, like Jemima, like everyone that's spoken today, I'm 100% clear that the need for the original plan is absolutely essential. So although I've asked that question, and we do have to compromise sometimes, without a doubt, I represent this area and I know these people and I know what they need.
Sarah, I want to bring you in here just briefly. I appreciate that the practices have people living outside of the PL1 area, basically, as well as the client. But what is happening at the moment with the health stats for that? Are we seeing any improvement at all in the health stats for St Peter's and presumably the bottom bit of Stoke and Devonport?
To be honest, they're pretty stable. We know they're some of the worst, and in fact, some, for a lot of factors, the worst in the city. But they've been pretty stable in that position. They're, which has been our challenge, as you know, around the inequalities, as forever they're long-standing, ingrained, and very hard to shift. And so we're not seeing a worsening currently, but
is it still that same? I mean, it used to be something like 10 years difference between the west of the city and the east of the city, or the other way around, sort of thing. But
it's just under 8 at the moment. So I think that's in the supplementary paper that Ruth provided to you. Is some of the gap in our life expectancy across the city is about 7.7 or 7.8. I think so. It's in there. Yeah.
That's useful to know. Thank you very much. Natalie.
Thank you, Chair. And mine carries on really, I think, from what Councillor Tuffin has said about, what can we do in the meantime? From my perspective, you said that there's potential for the diagnostic centre, UHP, to be there. Surely, if the designs can be worked adequately, to actually do something in stages, to be looking at the jigsaw puzzle. It's not perfect, I appreciate that, but actually that's maybe costing less money. Maybe there's more opportunity to bring in a smaller amount of money that might be costed and feasible, but actually just to start the process. It's not going to help the GP practices in terms of the patient sort of having GP services there, but actually some of this is about the other early intervention, isn't it? And having other services there that they can tap into, the dentistry, for example, and actually just starting somewhere, but with a plan that actually it is going to be in segments. It's a bit like doing a Lego thing. You might start with one bit and then you're bolting on. So if the plan is worked by the architects effectively, that actually then you can bolt on when the funds allow. It's not perfect, I appreciate, and this area absolutely needs it. And I hear what you're saying, Sarah, regarding it staying the same, but we know that we've got a high number of sort of vulnerable people who are coming into our areas, refugees, asylum seekers, etc., who will come with additional needs. So on top of our existing sort of population, we've got people that really are also going to get, and that's not going to go away, because that's where the most of that cohort are centred.
I don't want to make the point that I'm not saying these are our most challenged populations. We all know that. So it's just that at the moment that it's pretty stable in terms of statistics and the measurements that we use to look at that.
Matt, I want to come back to you about the financing for the diagnostic centre as well, because that's a different funding, isn't it?
Yeah, thank you, Chair. Yeah, I was just going to make that point. So UHP and Derriford have bid for funding to cover the whole of the cost of providing the new CDC. From what we understand, the cost would be around 25 million, and they've bid for the full amount. So it's a completely separate funding pot. There wouldn't be any ask of NHS Devon, for example. And we had been told that they were expecting to hear whether or not that funding bid had been successful by end of February. They haven't heard yet, as far as I'm aware, but a decision on that is imminent. One of the other things I just wanted to flag is that when Tracy Lee and the leader and Jane and Clive Shaw, the project director for the Consultant, went to meet with Lord Markham, one of the issues that they raised was whether it would be possible to essentially maintain the existing Cavell building and provide within it a CDC as well as some primary care services. And one of the reasons for asking that is because we have been advised by Stuart Windsor from UHP that because of their various funding regulations that they have to comply with, they would have to have a standalone building, and they wouldn't be able to go into a building that also had primary care within it. Anna probably understands a bit more than I do around the funding rules and can probably explain that further more.
So I don't think I've got anything to add, Chair, because I think sometimes you get to the place that Jemima is, which is common sense would suggest that actually you could bring these things together. But I think that was why one of the asks to Lord Markham was, is there a way that you could align CDC funding with support from primary care being in the same building, and what would that look like? And clearly, as you've heard from Joe, Nigel, we're waiting to have a response from that ask. But as it stands at the moment, our planning assumption is that that isn't something that is helpful for us to back, as it were, as a possibility. So hence going to the space, and I think Natalie's point's really key. You know, actually, what might we be able to do on the site that creates the environment? And I don't know if Matt wants to just come in on some of the how do we then refresh the plans as part of that redevelopment site, to think through what the jigsaw puzzle might be to address some of the health needs, acknowledging that actually, as Joe's described, there's an awful lot of work to do to ensure that we've got resilient primary care in the current environments in which they sit as we go on that, you know, the next journey together.
I think one of the key things to flag is that the CDC funding would come with some fairly challenging milestones in terms of delivery timescales. So what we've been advised is that they're looking to submit a planning application by June, get that determined by September, and then be in a position to start on site by April 2025. April 2024, beg your pardon. So it'll be open by April 25. So we would have to make a pretty quick decision, which is one of the reasons why we can't just sit around and wait for the potential for a spending review to take place in the autumn next year. And we need to give UHP some certainty around where they can focus their attention.
Lee, I've got you next, and then Patrick.
Yeah, I just want to take on a point that Councillor Nicholson made. I think it was regarding the messaging is primarily where I was coming from. There was a lot of positive messaging put out there with regard to who was responsible, NHS or the City Council. And I think the Council got the bad end of the stick on that one. I think we need to look at, say, what the NHS has actually taken away from Plymouth in the last 30 years. We've lost 8 hospitals, we've lost countless doctors' surgeries, and yet we have population growth. Is it fair to say, as a result of this meeting, that we know of 3 doctors' surgeries that are in effect uncertain water, yet we have 160 properties proposed for Bath Street, and it could be argued no primary care able to accommodate these people? We cannot afford to lose this site for the NHS provision. If we look at it over many years, the distribution of services has all gone to the north of the city in the Derriford area. Plymouth is expanding north, east, south and west, so we need something to the south of the city. to mitigate or break the constant movement to the north of the city. And in not doing so, there are huge economic and social costs to everyone and every stakeholder in this city. And that is uncalculable with regard to somebody's house. How do you put a price on on the price of a life? So I think we have to be seen to doing something, and we really do need to put a timetable together which we have a start, a middle and a finish. And I think with a positive will, and above all, will of everybody to do so, something can be achievable. There has to be that way. Chair.
Okay, on regards of that, this money was muted by government. It was then government that have pulled the plug. So as far as I'm concerned, we as a city council have done everything we can to be part of that. So, you know, I think we have to look to that. So I think whatever we come out with here has to be looking at the whole process. And there's, I suppose what I'm really angry with is that carrot was dangled, and then you've merrily got a department that said, no, we're going to forget it, without any thought about the impact it was going to have on this city and 5 other cities. And I think that to me is the most disgraceful bit about that. And I know Patrick has mentioned about several of our MPs not standing up. I know that Luke Pollard definitely stood up because it was in his ward, so therefore he was making sure that, and it was through him that I got to hear that there was a question mark. So I don't want to get party political on this, but the government has to accept responsibility for this. And I think Patrick is right in that we have to be calling our MPs to be standing up for the city, definitely. So regardless of what else comes out of today's recommendations, we certainly welcome that, Patrick. Thank you. But we have to think about the health of our population. We have to think about the population growth. It isn't just those 160 houses or apartments in Bath Street. You're talking about, you think about Debenhams building, we want to build there. We want to build in our city centre to get people living in the city centre. They don't have GPs at the moment because they've not arrived in the city. So, you know, we have to think about this positively and think about how we're going to manage it. And yes, Joe and Nigel will be having to go back. If they don't help with this because they can't financially, they are going to have to find out how are they going to get more GPs into Plymouth? How are they going to find premises? Because if these 3 premises have to be revamped and looked at, we know that they're not in the brilliant condition now, that's been said. So how are they going to do that within the next few years? So there's a big financial headache for the ICB, whether it helps to provide this or not. So I think we have to think very carefully about when we start to come with some recommendations, because it is affecting our population, it is affecting our city's growth, let alone the growth that we've seen in the latest census figures. So I think we have to think about this, and people have always gone to whichever GPs they've wanted to, but I think more and more people are having to go to ones nearer where they live, and if we're growing the city centre, they're going to be looking, and if they're going to be told North Road West, Adelaide Street and whatever can't take any more patients, where are they then going to go from there? So I think that's a big consideration as well. So, anybody else? Patrick, do you want to come back on that?
It's just a quick one. I totally endorse what you said, Chair, and certainly, you know, people are going to go and experience the same situation with GPs as they have now for many, many years in terms of dental healthcare, and it's just, you know, a massive issue. I wanted to just come back on the design, because Anna and others will be aware that it was no mean feat to get a planning application through on the proposals for the Cavell Centre, and I would just caution, it's fine, it was a modular build, but having piecemeal development actually costs a lot more, and you end up with a poorer quality of building. And I think we just need to recognise that Colin Campbell Court was always seen to be needing a good development to anchor that end of the city centre. So I wouldn't favour a cheap and cheerful compromise. You know, colleagues to the left talked about aspiration, and we need to have aspirations in the city to have a good quality build, delivering the services that we need. And that for me is the bottom line. I don't want cheap, cheerful, temporary accommodation that houses a few more dentists for a few years. Let's continue to fight for what we deserve, which is quality healthcare for the services that we sought and the services we need for the future. And nothing less is good enough. So I think the first thing, Councillor Finn and all of us, is to be lobbying our members of Parliament when we go home. And remember that they need us in a few weeks and months' time, canvassing on their behalf. Well, I will be. I'll be canvassing on behalf of myself and the public. but ultimately, you know, and I would say when we come to recommendations, Chair, it's important that we have the Devon dimension, because with the Devon dimension, we should get actually more clout than if we just leave it to the 3 local members, albeit that they do have some influence. So I think I'll shut up now until we get to the recommendation.
Thank you. John, do you want to come in there for a minute?
Thank you, Mary. I think I'm here more to listen than comment, but I do have some comments. I mean, I came into the Cabinet Post thinking that we were going to do the Cavell Centre, that it was all going to happen and set up, and it was only in the autumn that the rug was pulled. I mean, it is an incredibly good deal at a fixed price, which I don't think anyone's mentioned. We probably won't, with rising building costs, get such a good deal again if we lose this. And from the time I spent 10, 15, 20 years ago sitting on health committees for the PCT and the CCG, health inequalities across the city were the big issue then, and they still are, and we haven't really done much about it. And it's not just rehousing the GPs, it's much more outpatient treatment facilities, particularly mental health and dental facilities that we need in this part of the city to improve people's health and well-being. One has to come back to the fact that Plymouth is not, and never has had, and this has been discussed for 10 years or more, fair shares in Devon. And you know, we still aren't getting our fair shares, and out of a £2.4 billion budget, which is what One Devon NHS gets, you know, a couple of million, perhaps a bit less, perhaps a bit more a year, if someone else is providing the capital, doesn't sound to me like an impossible ask. And as people have said, the consequences of not doing it in the long term may be greater in cost terms, cost financially, but also a lot of cost to people and individuals who suffer ill health and ill well-being. So there's such a thing. So I think if we don't do this by one means or another, then it is very disappointing. One could say more, but perhaps better not. So, you know, I think anything we can do to lobby. I'm sure that the Plymouth MPs are fully aware and are, you know, having lobbying behind the scenes. Whether, of course, the rest of Devon, being cynical, actually wants to join in is another matter, because, of course, if we get more money, ostensibly Devon may get less, and that has been part of the issue for many, many years. So those are my thoughts on it.
Thank you. Jemima?
I'm just thinking about, I don't know, this committee sitting in this room in 10 years' time or 20 years' time and looking back on the minutes of this meeting and going, what do you mean you had a site and it was prepared and you had planning permission and you had the GP surgeries all on side and you had someone to loan you the money and you didn't do it? And you didn't do whatever it needed to happen to make it happen. And I think they would look back with absolute incredulity that we had an opportunity of this calibre to really change things for a lot of people in our city who need things changed for them. And I think that would just be my final thought on it. I literally think if you look back on this in 10, 15 years' time, you'd be like, how didn't this happen? You're so far down the line that we can't give up now. Thanks.
Thank you. Anybody else want to be asking anything? No? Zoe?
I don't know anything about this, but if you're not in budget to pay money back, what gives? If you do decide to do it, what loses out if you put the money back to pay him back? What happens?
Yeah, no, thank you, Zoe, for the question. It's a really good question. So at the moment, unfortunately, we're in a place where we're already in deficit on our budget, so we can't commit any more money to, because we haven't got the money to commit, we just can't commit this money. So in some ways, we can't even get off the starting blocks in terms of that. But what's really important is the work we need to do now needs to focus on how do we support people, how do we prevent people from getting ill in the first place, how do we really focus on that early intervention, and if we do that we will be able to turn the tide on the deficit, and that's the focus. That's what we really need to do. We need to look at the parts of the system that are in deficit, and that's across the whole of Devon. So Plymouth's no different than that, but the other parts of Devon are in exactly the same place, and that's the focus, because if we can get back in balance then all of these things come back in our gift to do. So I think that has to be our focus moving forward.
It's not really a question. I guess I just taking the opportunity for the people that, you know, I don't. I'm new to all of this. I'm new to politics. I'm new to scrutiny. I'm new to everything. But I guess I'm gonna take my opportunity to say that the people that I came into this for are the people that would be using this centre, and actually are the people that are forgotten all the time. They're the people that are at the bottom of the pile for food. They're the people at the bottom of the pile for houses. They're the people at the bottom of the pile for dentistry or whatever. And actually, they're probably not even that bothered about dentistry because they're that far down that they just like a bit of a break. So I guess I'm just taking, it's not a question, I'm just taking the opportunity to say that, there are a whole heap of people that everyone's talking about now, but there are also a few people that have absolutely nothing.
I couldn't just ask Joe one point, because the way Joe, very ably answered Councillor Riley's question, it's not a simple thing trying to balance the books in the health service, and we've got to recognise as politicians there isn't enough money in the system. So Joe said all we've got to do is to try and get our £800 and some odd million to balance. Well, it isn't as simple as that, and the NHS has been struggling for donkey's years, and members need to be realistic that politicians nationally need to make choices, and the choices effectively are that the health and adult social care system massively needs extra investment, and that's the message from this meeting, that whatever you try and tinker, you're never going to balance the needs that currently exist in our society and in Plymouth and Devon with the budgets that are being allocated to the officers and officials in NHS, and that's the reality, isn't it? And the likelihood of balancing the books, Joe, in the foreseeable future is probably nil.
It's going to be extremely challenging.
Joe, can you just remind us what the budget for the ICB is for the year roughly?
2.4 billion.
And what's the overspend at the moment then?
Yeah, so this year we're at about 50, so it's 53 for this year, but next year, so we're still in the operating planning round, so I can't give you a definitive figure for next year, but I can tell you that next year looks significantly worse at the moment than this year, albeit we are trying to bring plans back in line that reduce that.
Okay, Patrick.
So that's why bringing wider Devon, answering Councillor Dr. Mahoney's point, is that if you can ease the stresses in Devon as a whole, they might actually have a fair chance of targeting resources for the most needy aspects of Devon, and not the base funding for the nicer parts of Devon, which are pretty extensive, are insufficient as they stand. So what chance are they got to target the most needy areas of Plymouth and most needy areas of Devon as a whole when they can't actually deliver basic care for the average population of Devon?
Thank you. Right. No more questions there for the moment. Now, what are we going to... Okay, folks, we're going to have a 10 to 15 minute break. So what's the time now? 20 past there. So if I say 25 to 4, we'll come back and then we'll get some recommendations out of this, all right?
Why are we going to do recommendations in secret?
We're going to do it in... Sorry?
Why can't we move recommendations, have a discussion of recommendations in public? You know, I don't,
Yeah,
we've
we
had
can
a
have it in
debate.
public, it's not a problem, but I just think we just
Well, I
want
can
to...
have a break, but
yeah,
I think we
take
should
a
do it in
break
public.
and then
It
we'll
shouldn't
see.
hide away.
It's as long... Yes, not a problem. It's not a problem, yeah. Okay, all right. Thanks, folks. We'll see you back here at 25 to. Can I say thank you very much, Joe and Nigel and Matt? Can you hang around just to be absolutely sure there? But Joe and Nigel, thank you very much, and we'll come back to welcome back, and thank you to the committee for putting their thinking caps on and getting the best possible recommendations out. Now, we accept the recommendations are, I'm going to say, slightly bit more than rough outlines. But they may be sort of they're not word perfect by any means, but Elliot has done a brilliant job so far, especially on a Friday afternoon after he's had a busy week with other scrutiny all week. So, Elliot, the floor is now going to be yours to read them out.
Thank you, Chair. So recommendation number 1, roughly drafted, that the Chair of Health and Adult Social Care writes to the National Audit Office expressing concerns regarding the expenditure of the CAFEL programme, which now appears to have no DHSC funding for delivery. This has led to reputational damage for local authorities, which must be prevented in future. Recommendation number 2, that NHS Devon provide financial viability to the committee to ensure funding is proportionate to the population and needs of the city. That was visibility, not viability, excuse me. The committee thanks Joe Turl and Nigel Akerson for their attendance today, but is disappointed that the Chief Executive Officer and Chief Financial Officer were not in attendance and will be seeking further communication. The committee recorded their concern about the viability and sustainability of the 3 GP practices which were due to take up residents in the West End hub, as well as the voluntary community and other health facilities that were planned to be accommodated. The committee recommends that a Devon-wide meeting with MPs be convened to ensure accountability and ongoing cooperation to improve Devon and Plymouth's health outcomes, and continues to lobby to secure funding for this project. The committee recommends that the ICB or NHS England prioritises systems working in early intervention and prevention, prioritising long-term need and not just short-term financial and viability. The committee recommends that NHS Devon assure this committee that there is appropriate healthcare in line with the plan for homes and Plymouth housing growth, and seeks appropriate contributions through Section 106 agreement. The committee recommends that NHS Devon respond within 15 working days with a plan to ensure they have sustainability and viability for the 3 GP practices affected. And the committee recommends that the ICB report to a future scrutiny meeting on the work being undertaken to support local GP practices and ensure health outcomes are maintained and improved across the city. That the Chair of the Health and Adult Social Care Committee writes to NHS England regarding potential for funding interest payments on the capital loan for the development of the CAFEL Centre. Recommendation that officers work with University Hospital Plymouth to look at the master plan for Colin Campbell Court site regeneration to ensure the most appropriate site for community diagnostics. And finally, that the Chair writes to the 3 affected GP practices managers seeking their views on delays to the CAFEL programme and offering to broker a meeting between all involved, including the portfolio holder, shadow portfolio holder, ward councillors and public health. Any more you may add, Chair?
Well, thank you very much indeed, Elliot, for putting all of that together. And as I say, committee, we will send you out the finer tuned version of that, but it substantially won't change the content. So again, thank you everybody, Sarah, Elliot and Anna. John, thank you very much indeed for coming along as the Cabinet member. It's been really useful. And just leaves me to say thank you to all of you, those of you that have subbed because other people couldn't come. It's been really worthwhile having you here. So thank you and have a great week.